I think that when Kathy was talking about how the autism label itself conveys almost nothing about what to do for a person or their family, I think we need to kind of uncouple the diagnosis from the assessment and see the assessment process. And it may take on various forms and be done by various systems. That's another thing. I mean, we have a lot of redundancy in our systems that maybe could be solved if we were to work more together between the diagnostic providers and the treatment providers. So I think there are a lot of things that could be done differently there. But to understand that the value of this assessment is to figure out something about how someone thinks and under what circumstances they perform the best, because that leads directly into recommending what services might be appropriate at this very moment in time, more than any diagnostic label. I think the other thing is that, I mean, I was brought up to think about lifespan care by my mentor here. And if we think about this as the beginning of a relationship, the assessment as the beginning of a relationship between a clinician or a team of clinicians and families, we also, I think, can increase efficiency over time, spending the time to develop that relationship, because then you become a touch point, a care touch point where you can help people relatively quickly. The fact is that if we're thinking about this as a one and done and you're out the door, then people are going to really have to do a lot more work to start over each time to figure out where the person has been and what's worked and what hasn't worked. And I think that continuity of care, even just psychologically for families, knowing that they have somebody who they can call up and say, what do you think? Should I seek this kind of help or that help? It overall reduces burden in our systems, because when people feel like they're not getting what it is that they need, then they end up going on multiple waiting lists often. Or, we'll have kids who are coming in for their fifth assessment because they felt like the first four people didn't see them or really hear them.